We now have a much more transmissible variant, and I'm afraid this is the sort of natural evolution of viruses. The ones that can transmit the most effectively have an advantage over other variants. And so it's clear that this new variant is transmitting more readily. It's transmitting more readily in younger age groups as well. It's important to note that it doesn't appear to cause worse disease or that it's going to be more resistant to the effects of the vaccine, but it is going to be very, very difficult to keep it under control without much tighter social distancing measures.
And would that include closing schools?
Well, potentially. I mean, we know that transmission occurs within schools. We know that a person between 12 and 16 is 7 times more likely than others in a household to bring the infection into a household. And we know that there was a small but a dip in the amount of transmission in school children after the half term, which then went up again when they went back.
These restrictions have been in place since December the 20th or thereabouts, these Tier 4 restrictions, and yet the epidemic is spreading. Hospitals are quite close to being overwhelmed around the country. Are these Tier 4 restrictions, therefore, enough, really?
It's the Tier 4 restrictions, it's obeying them, it is thinking about breaking essentially every possible route of transmission we possibly can. Those are the things that are absolutely necessary, and it is pretty clear we're going to need more.